Welcome to the 11th Johnson's Baby Sense Seminar. The seminar is done in association with our media partner, yourparenting.co.za. Is your baby sleeping through the night? Is probably the most commonly asked question. Sister Ann Richardson, the co-author of Baby Sense, will now be sharing some of her sleep secrets with us.
I have been tasked with, in 45 minutes, to take you on a whistle-stop tour of sorting out your baby's sleep secrets in the first year of life. So let's get going. Okay, right. So a lot of you will actually resonate with this. Don't talk to me now. I was up all night keeping my parents awake and I'm absolutely exhausted. So if we can just have a show of hands, who's pregnant? First child. Yeah, okay, so we've got about nearly half of the audience who aren't parents yet. Babies sort of 0 to 3 months of age, okay, and up to 6 months of age, and 6 months to 1 year. Okay, right. Try and really just to every microphone, yeah, there, okay, right. Okay, so the first thing we need to do if we've got an issue with a little one who's illness, I have no control over this. So we need to rule out illness. So that's the very first thing. If your baby's unsettled or suddenly becoming unsettled, please just make sure clean bill of health. The second thing, obviously, in the beginning, especially when your babies are little, is that we have to ensure that there is absolute optimal digestive health. Now, we do know that from a colic perspective, the digestive issues is really not a huge thing, but it has to be ruled out. Now, our little newborn babies really have incredibly immature guts. For the first 12 weeks, their guts are immature, their brains are immature, and their skins are immature. Those three main organs. So we really must be very careful what we put into our little one's guts. And even if your baby is 2 or 3 weeks early, which is not technically a prem baby, that can be very significant in terms of how well your baby is going to digest food. We obviously know that breast is best, but I am going to come to that. The other thing there, and I've just put it down, a C-section hangover, is that our C-section babies miss out on ingesting a lot of your good bacteria in the actual birth process. And Mother Nature puts that bacteria there so that your baby can be colonized to really get good gut function going. Our C-section babies are born into this incredibly sterile world, and they miss out on that. So it's a good idea if you're planning on having a C-section, or you've got a young baby who might be a little bit fractious, get your baby onto a probiotic. And a probiotic, you all know what a probiotic is. Okay, it's good bacteria. And you need to, and just write this down, you need a probiotic with a high concentration of Bifidum bacterium. That is the ingredient that you need to be looking for, just to ensure optimal health, gut health. A lactose sensitivity, a cow's milk protein allergy or sensitivity, and reflux. I know Claudia has talked about those. Those are all issues that need to be addressed and dealt with if you have got an unsettled, wakeful baby. Okay, so do we demand feed or don't we demand feed? And that little oak saying, if olive oil's made from olives, oh my God, what is baby oil made out of? Okay, that's been doing the rounds a lot. You've probably all seen that, but I love that. So we need to get feeding established. We do realize that demand feeding is what's going to make your milk and to get feeding going in the early days. But very often it kind of sneaks up and bites you down the line when your baby cannot fall asleep without being fed and doesn't know how to separate calories from comfort, which is all fine and well, because you cannot spoil a newborn baby. Your newborn baby needs to be in your arms, particularly in those first 3 months of life when their brains are immature and they access stimulation. Separate calories from comfort. That's bringing a new countryman now, and hopefully the sound issue will be sorted. We need to use our common sense and tap into thinking, is my baby really hungry? Does he really need to feed? Or can he just... Let's just quickly mic up here. I apologize. Hello, can you all hear me? Is that better? Okay, right. Let me just get attached here because, believe it or not, even though I am a woman, I cannot multitask with one thing in each hand and try and talk. Can't do it. Right, okay. So we need to use our common sense and we need to be sure that we're separating calories from comfort. But I'm going to take you through each age group shortly. So I would say that just use a broad spectrum of time, which is if it's less than 2.5 hours plus minus-ish since your baby's last feed, don't feed. Rather use alternative methods of comfort. If it's longer than 4 hours, well, clearly your baby's hungry, so give your baby something to eat. So just use those as a very broad time frame to work with. Okay, so a lot of you who already have babies, particularly young babies, might be caught in this snack mode, which in certain cultures is absolutely no problem. Because for the first 3 months of life, mom just goes off to her little sleep space or her little sacred space, and her and her baby just feed and get to know each other for 3 months. The village cooks the food and buys the food and does all that. So that's not an issue. But in our Western world, a snacker might become a bit of a problem. So that's a baby who is growing and thriving and growing like a weed, but they only catnap. They have a little nibble, just enough to keep them going. And then they drift off to sleep for 20 minutes or 30 minutes and then wake up and just another little nibble. And so it continues 24/7, day in and day out, which can become quite exhausting. So if you've got a snack and you want to do something about it, this is what you can do. So we need to separate calories from comfort. Just remember that mantra. It really will hold you in good stead. Separate calories from comfort. Watch your baby's sensory signals. Is he fussing because of something else? He might not be hungry, and I'm going to talk you through those signals. Watch the awake time. Babies cry a lot and appear to be hungry when they are actually tired. So maybe he's not hungry and he's tired. And always offer alternative methods of calming. So that's the rocking, the holding, the swaddling, a dummy. If you like dummies, I love dummies. I think they are the best invention ever because we know that babies can settle with their mouth and their midline. That's why in all your scan pictures, your little baby's always got his hands somewhere close to his mouth. And the arms are always in the midline because they've got a startle reflex that makes them go away from the midline, which wakes them up. So you want to really offer alternative methods of calming. And if needs be, if you're wanting to get rid of the snacker, often what works well, but you must do this under the guidance of your clinic sister, is to do a top-up feed immediately after breastfeeding so that you can exclude hunger. And I do that. It works very well. I put my moms on a trial of 48 hours. We do a bit of pumping, so we've got breast milk to top up with, and so we can encourage a baby to become an effective feeder as opposed to a nibbly feeder. Okay. Sometimes if baby is being formula fed, you need to just simply change your brand of formula onto a more filling formula. Because some babies are starving Russians. They need to just eat. And others really, they eat to live as opposed to live to eat. It's all a personality thing. Okay. But the most important thing from the word go, once you've got your feeding established after the first few weeks, is to avoid allowing your baby to fall asleep while feeding. This is a few weeks down the line. So let's go and let's talk about what about really making sure, is my baby hungry? Is that why the baby is starting to wake up more frequently at night, or not go into an age-appropriate length of time to actually sleep in the night? So what you're going to see is you're going to see if it's only related to hunger that your baby's sleeping patterns are not great. You will see a marked shift in his hunger status and his sleeping status. So things were going really well and dropped that sort of pre-midnight feed, and suddenly they're eating again like little newborns, just starving, starving, starving. So it's a marked shift. Okay. And so you'll see that very often this all happens round about 4 months of age and round about 7 kilos. So you will see, but you need to then go speak to your clinic sister and discuss your baby's hunger status and address it so that you can start looking at a reasonable stretch at night. So let's really just get to understand what our baby's personalities are like. So as the slide says, sometimes I pretend to be normal, but it gets boring, so I just go back to being me. And remember, your babies all have personalities. It would be so easy for us to just have factory-operated clones that get spat out in a factory, because those babies will have predictable everything. So, well, I'll be out of a job. I'll be on the beach. So we need to get to know what is going on with our little ones. So this is a sensation avoider. Those are our shy, clingy babies. They don't really like being handled a lot. They don't like being out and about. They're very sensitive to bright light and loud noises. And they love routines. They love rituals. These babies generally need a lot more sleep than other babies. And they can't manage long periods of being awake. They kind of lose it much quicker. So you might have a baby that's that. Then you've got, this is our normal, just our real happy-go-lucky. We would all love to draw this straw, but we don't always draw this straw. This is the kind of baby that no matter what you do or what you don't do, doesn't matter. They'll eat if you want to. They won't eat if you don't want them to. They sleep through the night. They sleep under restaurant tables. You can vacuum under their cot. They're chilled, chilled, chilled. Okay, we don't always get them, though. Then we've got these ones, the sensation seekers. These are these super alert babies. From the minute they're born, those eyes are open. They don't appear to need a lot of sleep. They survive on cat naps. They sleep for 20 minutes and they wake up and they're ready to go again. And they don't miss a trick. Those little eyes and that little head just goes like that. Just don't label this kind of a baby a hyperactive baby. It's who your baby is. You have to learn to adapt to your baby's personality. These babies don't need a lot of sleep, so they seldom sleep for long stretches, like the books say, you know, the 3-hour sleep in the morning and the 2-hour sleep. No, they haven't read that book. You know that book. They haven't read it. Okay. They can manage with a whole lot longer awake time. So those guidelines that we give you of awake times often do not apply, because you'll look and you'll think, he's not ready to go to sleep. So just try and see where your baby fits in. So how does he cope with his world? We all know we've got 5 senses, the good old seeing, hearing, tasting, touching, and smelling. Your babies, or us humans, we've actually got 8 senses. There's 3 more. There's a sense of movement, which is controlled in our ears. It's our balance center. So every time you lift your baby up, you put him down in his bed, you do whatever, you're stimulating his brain. So just remember, when you're putting your baby to bed, don't put your baby head first, because that's usually why you get the baby to sleep, and then you put them into the cot, and as you're lowering them into the cot, or as you step away, ka-ching, there those eyes. That is because you've put your baby down head first and you've stimulated that sense of movement and you've woken him up. So just lower him into his bed. Okay. Then there's another sense called proprioception, which is his body position. It's messages from his muscles. Where my arm is, where my leg is, am I upside down, am I, well, you know, whatever. More stimulation to your baby's brain. And then there's a sense called interoception, which is messages from your baby's organs. Do I need to poo? Do I need to fart? Am I thirsty? Am I hungry? Have I got a wind? So there's a lot of action happening into that tiny little brain. And remember what I said, in those first 3 months of life, your baby's brain is very immature. So they really battle to... Und now? So they really battle to... Thank you. Well, let's just find our way here. Where are we? Slideshow, sorry. don't know. We need some, oh, there we go. Okay. Right, so in comes the stimulation. We can choose as adults with mature brains. We can choose to respond to it or we can choose to ignore it. But our babies under 3 months of age can't do this. They're getting everything in multi, techno, beat, which is why you need to modulate that environment and keep your baby in its calm, quiet state. So as you can see here, what happens with stimulation? From being chilled and calm, and I think the Cape Town babies are much more chilled and calm than the Gauteng babies. They spend more time here. And then as the stimulation comes in, happy, content, too much stimulation, the storm clouds gather, and then we have our all fall down. So when do you know what to do what with your baby? So your little baby, when he's ready for stimulation, and Megan's talked you through about all the wonderful things that you can actually do, your baby will start to give you these signals. Alert and awake and engaging with you and eye contact and responding to you. That's the baby we all want, and we would love our babies to be like that all the time. But they don't work like that. As that stimulation comes in, your baby's going to start giving you some warning signals to try and tell you, if he could talk, just, calm down a bit. Just, help me feel a little bit better. Stop this arm of mine from going out in that primitive reflex, which is keeping me awake. Hold me tight. Turn the music down, whatever. Very importantly is that a lot of these signals, you can see the hands clasped together, sucking away on their fingers. You'll think, oh, it's teeth or it's hunger. It's neither. It's just your baby trying to learn how to self-calm. Bracing of the body. In other words, that straight thing. I'll show you a picture. There you go. You can see that hard little back. You can all recognize these pictures. There's there. If he could talk, he would just say, please turn the lights out. Okay. And there's the little hands being clasped together in anguish and the lack of eye contact. So these are warning signals, but you've still got a chance to actually just calm your baby down. So, the biggest signal is that your baby will lose eye contact with you. So what do you think your baby is? Oh, he's bored with his toy, he's lonely, whatever. So you keep trying to engage with him, and he keeps going with the shifty eye, trying to say to you, please, I just need some calm down. Very importantly, changes in vital signs. So what that really means is that when your baby goes blue around his mouth, he does not have a wind. It's a neurological sign that his oxygen saturation levels are dropping because his brain is in such overload. So the minute you see your baby going blue around the mouth, you know he's tired. Yawning, sneezing, and hiccuping are all signs of sensory neurological overload. Okay, so the hiccuping's got nothing to do with the wind. And of course the irritability. So there you've got your colicky baby. Look at the tongue stuck up there. Tongue thrusting, grimacing, frowning, grunting, yawning, sneezing, hiccups, color changes, the blue around the mouth, gagging, spitting up. And I'll show you a picture, and then, of course, you have the complete, look at that, shame. And so what do you think? Colic. And then you've got the all fall down. This baby here in the middle is my oldest daughter, who's now 25, and she really was a beautiful baby, I promise you. I'm not just saying that. I remember that day well, and I'd obviously woken her up, for the photograph. And you can see, look at those mottled eyes, the blue round the mouth, the fisting, cloth nappies still in those days, chaps. And, yeah, that is a sign of an overtired baby. So just remember that. And that is often the time where you think, oh, shame he's tired, we should try and put him to sleep. And then you wonder why you have to spend so much time putting your baby to sleep. And I have moms in the practice, I see nearly 200 babies a month across the board. And 9 times out of 10, the patients will say to me, or the moms will say to me, my baby fights sleep. That's that. Look, that's the fighting of the sleep. So we want to cut the middleman out. Ding, ding. And we want to go from happy to asleep. That's ideal. So how do we do it? We watch those awake times. And for those of you who haven't had babies yet, you'll be shocked to see that in the first 6 weeks, your baby can stay awake for between 45 and 60 minutes. Before it's all over, it's all fall down. He needs to go back to sleep again. So that doesn't give you a lot of time to do your caregiving. That includes a feed and a poo change and a nappy and maybe a bath and a visit and a whatever. So our newborn babies need to do nothing more than hopefully just sleep and poo. Sleep, poo, and eat. Or sleep, eat, and poo. Let's get the sequence right. If we go up to our 1-year-old, they're still needing a day nap. Some children, remember our ones who need a lot of sleep, will still be sleeping twice a day because they can only make an awake time of about 3 to 3.5 hours. Our children who can manage a longer awake time can push it a little bit, and they will only sleep once a day. So a lot of you are thinking, yes, but my baby doesn't fit into any of these categories. He can stay awake for much longer than this. What I'm saying is that if your baby is happy, so number one, he goes to sleep without a fight. He's awake for a reasonable period of time, and he sleeps for a reasonable period of time, even if it's 20 minutes. Your yardstick to work with is he waking happy. If he's waking happy, chipper, he's had enough sleep. And is he functional for his age? And if the answer is yes, well, then you don't need to change anything. If it's not broken, don't fix it. Remember, these are guidelines. So just to explain to you what happens with sleep is if you can take here, child, mom, dad, everybody wakes up tired in the morning. If you're missing those signals and pushing those awake times and having to fight with your baby, overtired, fussy baby, what happens to our brains when we become overtired? And you can all relate to it when you're working late on a project or busy kind of, studying. What happens is that our brains get flooded with stress hormones and adrenaline and cortisone in order to keep us awake, for the caveman to be at the cave door so he can slay the dragons that they won't eat his children. So that's what happens to our babies when they get overloaded. So what happens is that they become very tired and fractious. And these are your toddlers that are still swinging from the chandeliers at 10 o'clock at night, and you think they're not tired. It's because they're flooded with stress hormones. Can't fall asleep without help. So you're having to rock, drive, suck, swing, hang babies on washing lines, put them on top of tumble dryers, all the tricks in the book to try and get them to go to sleep. But what happens, because they've fallen asleep in this overladen state, is that they have fragmented sleep. So the fragmented sleep is what your disturbed night is. Obviously, if you've got a newborn who needs to eat a lot, well, then it's totally functional fragmented sleep. So just remember, and I'm going to give you age-appropriate times. So that's the fatigue cycle. You can all recognize that, those of you with problems. So let's talk about actually dealing with it. And that little thing says, you wanted to sleep all night? Allow me to sing you the song of my people. Okay, and that's what babies do. They cry. That's how they communicate with us. So first thing we need to look at, if there's something that you need to change, is what's happening with the sleep zone. And the sleep zone can be wherever you want it to be. Okay? The one thing we know is that co-sleeping with a baby has an increased risk of cot death. So if you want your baby with you, rather just have your baby in a crib or a pram right next to you, but not in the bed with you, just because of that risk. So you can choose wherever your baby sleeps, in a shoebox, in a drawer, design a nursery, whatever. As long as we're getting functional sleep and you're okay with it, it's fine. So, but obviously it needs to be in a zone that is conducive for sleep. I mean, that goes without saying. Right. So, now we might need to do some sleep training. And this little oak says, stop singing the song Rockabye Baby to put me to sleep. I mean, a song about putting a baby in a cradle in a tree and then have it come crashing down doesn't exactly make me want to close my eyes around you. Okay. So you need to give your baby confidence that you're okay with doing sleep training if you need to be doing sleep training. Okay, your baby has to get that confidence from you. This is how it's going to be, my boy. Right, so let's go back to our young babies. Let's talk a bit of wisdom with sense here. So, our newborns, we need to obviously rule out illness and anything like those lactose sensitivities and all the stuff that you've already learned about. Need to try, once you've got your feeding going after the first couple of weeks, is separate feeding from sleep. Remember that? Sleep is sleep and feeding is feeding. Modulate the environment. Make it conducive for sleep. Watch your baby's awake times. Watch your baby's signals. Swaddle your baby. Okay, you all know what swaddling is. That's wrapping your baby. But please wrap your baby with his hands close to his mouth, because we know that putting his hands in his mouth is an inherent natural way for him to self-calm. Don't swaddle with his hands here, because that's why all my patients say to me, he doesn't like being swaddled. It's, well, would you like being swaddled? You want to put your hands. You can see it's been a long morning. A lot of you have got your hands in your mouths because hopefully you're concentrating or you're biting your nails or you're desperately just trying to keep yourselves awake. Okay, but what do? We always put our hands in our mouths, and we always fold our hands if we're feeling insecure, if we're not feeling kind of secure where we are. Okay, mouth and midline. Remember that, M squared. Okay, so we're going to assist our babies to go to sleep with non-nutritive measures. So you can rock, you can hold, you can swaddle, you can do what you like. There's no rules about that in the early days. From about 6 weeks, you can start looking at your baby's rhythm, and out of your baby's rhythm, you will see a routine coming. So under 6 weeks, I don't want you to get verschrik and worried and anxious about my baby must be in a routine, all of that. You just go with your baby's rhythm. And after 6 weeks, you'll see that that rhythm will pan out, that you'll actually look at your day and you'll think, oh, yeah, you know what, that is actually a bit of a routine. My baby likes to sleep at this time and is revolting at this time and great at that time. You'll know. So we need to rule out in our 6-week-olds, same old same, digestive and medical issues, separate the feeding from the sleep. Calories are due, sleep is due. Watch the awake times, learn to read your baby's signals, swaddle your baby, and start now from 6 weeks with a bit of a bedtime routine. After 6 weeks, you'll work out when your baby likes to be bathed, morning, afternoon, whatever. You will also know when you would like to bath your baby. And massage is absolutely great as well. It really, really helps to calm your babies down, and I hope you're all going to be going to the massage session just now. We're going to assist our babies to become calm enough in order to go to sleep. Okay, some babies will need a lot of intervention. Those busy sensation seekers are going to need a lot of work to get into the calm state. Your happy-go-lucky babies, you probably won't have to do anything. You'll just put them in their bed and they'll go to sleep. Okay, right. So you're going to assist to calm. You can use rescue remedy from the age of 6 weeks. You all know what that is, rescue remedy. It's flower remedy. It's completely natural, and it works really well. And you just rub it onto your baby's pulse points and onto on their wrists, and pulse points on their little temples. And you can also do it by mouth, drop per kilogram of body weight. So if your baby weighs 3 kilos, he can have 3 drops of rescue, just to help calm him down. You're going to put him into his crib, and you're going to make sure that he's swaddled so he's not all over the place. A nice sort of heavyish blanket or your big hand on top, deep pressure, it's what they're looking for. Work through the wriggles and the niggles. So he'll kind of go, yeah, 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 yeah. Don't be too quick to pick him up, because remember, each time you pick him up, and you're stimulating his brain because of that sense of movement. Remember that. So you're going to work through the wriggles and the niggles. Obviously, if he's completely lost it and crying, you pick up and you re-calm quietly. No matter how long it takes, you just got to invest that time and effort to break a habit or an unhealthy sleep cycle, should you wish to do so. Okay. You're going to try again, and you're going to invest the time and effort. A baby from 4 months of age, we need to be looking at what is your baby's hunger status like. So often we do see babies becoming more hungry, and as I mentioned, we have to rule out hunger. So please, that is when you'll need to go to your clinic just to get advice on ruling out hunger. But we can expect a 6 to 8 hour stretch at night from 4 months of age at least. And generally the feed that your baby drops first is the feed before midnight. And everybody wants it to be the feed after midnight, but it's not going to be. Some babies do, but the majority drop that before midnight feed. So you just have to learn to go to bed early. At 7 o'clock when your baby goes to bed, you need to scuttle off ASAP, and then your baby will wake you up sometime after midnight, and then that 1 o'clock feed will become 2 o'clock, will become 3 o'clock, will become 4 o'clock, 5 o'clock. That's how babies learn to sleep through the night. So what's appropriate after 4 months is about a 6 to an 8 hour stretch. And you do the same old thing. Separate the feeding and the sleep, watch the awake time, read your signals, have your bedtime rituals. From 6 months of age, your baby will definitely be having proper food, solid food. So that means no more night feeds. If your baby's diet is adequate in the day, and your baby's healthy and growing, we can expect a 10 to 12 hour stretch at night without needing calories. So if your baby's still waking, it's not anything to do with food. It's for some other reason. Okay. And that's when we now start doing it, because sometimes by 6 months or even later, those bad habits have crept in, that your baby doesn't know how to put himself back to sleep unless he is being rocked or held or driven or fed or whatever the crutch is that you have been feeding your baby. Okay, so it's time to break that cycle now, should you wish to. Right, so in the sleep zone, we're going to assist to calm. So very often by 6, 7 months of age, you're caught in this whole thing about having to walk with your baby for 20 minutes or bounce on the balls, those blimmin' balls. They are great at the time, but sure, those babies become addicted to the balls. So if you're happy to bounce on a ball for 20 minutes before your baby falls asleep and throughout the night, great for you. You're going to really great. What are these muscles called? Hamstrings. But yeah, not sustainable if you're trying to work and be sensible. So we're going to assist to calm. You can try a bit of rescue remedy. And babies after the age of 6 months, if you've got a poor sleeper, it's a good idea to put your baby onto an iron supplement because his iron has been used up. Mother Nature gives your babies enough iron to last for 6 months, which is why they can be exclusively breastfed for 6 months and they don't need anything else. But iron is really linked. Low iron is linked to restless sleep. Your babies can have a type of a sleep apnea, which will wake him up to go and have a breath. But now, where's everyone? Especially if your baby was rocked, fed, assisted to sleep, and he suddenly wakes up, and he looks around and he thinks, where on earth am I? So a nightlight is also really important, so that when your baby wakes up, he can look around his sleep zone, recognize his furry little friends around in the cot, see his dummy, see his spot, and realize and think, it's okay, it's cool, I'm fine, this is where I am, this is where I'm safe, and this is where I can sleep. So, magnesium also works really well if you've got a particularly restless child who tosses and turns and talks a lot in their sleep. What that does, and we give that at bedtime, and what the magnesium does is that it calms down smooth muscle. For those of you who are still pregnant with cramps in your leg and whatever, your doctor would have prescribed magnesium for you. So that helps settle our children who may have growing pains or tummy aches. So we give that. Okay, just go downstairs and just talk to them at the Pepina stand, and they will advise you on the actual dosages of Floridix, iron and magnesium. You need to put your baby into his bed with confidence. Okay, it's bedtime, my boy. You are clean and dry, you're healthy, you fed, you watered, you loved. Your emotional tank is full. Toodle pip, it's bedtime. Okay. So you have to be confident. You're not going to go, oh, I'm so sorry, and I'm going to put you to bed, and oh my, well, and you know, no. He's going to think, why is she talking to me like that? Okay, so just remember, confident. And you need to shift your baby's expectations around sleep. So if your problem is having to rock your baby to sleep, feed your baby to sleep, thanks, Kirsty, that's what you need to stop, because that's what your baby's looking for in the night, unless you're happy to be up all night with your baby. Okay. And you need to invest the time and the effort. So I've given you notes in the manual. It's step by step. But in a nutshell, it's very easy to do. Okay, so we're not doing crying it out method. Okay, I really want to state that. That's what's given sleep training a bad name. We're going to just do lots of love and support, but break that habit. So at sleep time, remember, you've done everything. He's fed, he's watered, he's clean, he's dry, he's loved. Just remember that. Into his cot with confidence. Night, night, walk away from him. Older babies will keep themselves awake in order to keep you there, because they know that as long as their eyes are open, you will still be hovering over the cot. So they're confident. You need to be confident. Night, night, see you just now. Step away out of his line of vision. You might want to hide behind the cupboard or step out the room. It doesn't matter. Whatever you feel good with. You're going to step out and you're going to give him a chance for about a minute. It's only 60 seconds, guys. Your baby is not going to die and disappear into the stratosphere. For 60 seconds, give him a chance to see if he can sort himself out. So he'll scoffle about and cry. Some of them start to cry as you kind of just disengage from them. Okay, normal behavior. Don't be scared of him. You're going to step away for a minute. You're going to listen. If there's lots of shouting and crying, after a minute, you're going to go back. Pick up your baby straight away. And I know there's other theories out there that say don't pick your baby up. But of course you have to pick your baby up. You have to put your hands on your baby. Has he got a temperature? Is he wet? Is he all right? Okay. You pick up, you rock, you hold. You do whatever it takes to get your baby calm again, except feed your baby if you're trying to break a feeding to sleep cycle. Okay, so just apply some common sense here. So, and that might take you split second, or it might take you quite a while. So you really have to invest some time and effort. As soon as he's chilled and he's calm, but not asleep, he goes back into his cot. And after the second or the third time, he'll be very clever. The minute you just take a step towards the cot, he'll immediately arouse. All normal behavior. You've all got normal babies. So back into bed, night-night, step away again for 2 minutes. So you just extend your period by a smidge. Okay, from 90 seconds to 120 seconds. Go back, pick up, calm, soothe, settle, back into bed, leave again. Another couple of minutes, back again. So it might take you 3 hours to get your baby to go to sleep. But what will happen is that you would have achieved what you set out to do, and that is to teach your baby to go to sleep without assistance, because that's what you're actually trying to break, if it's that habit, or feeding, or whatever. You can keep expanding on that period of time that you're out the room, depending on how you feel. Some periods of time you'll feel quite sort of cross, and you'll think, just stay another 30 seconds or whatever, and other times you'll feel a bit sorry for your baby, so you'll go back. Doesn't matter. Easy way to remember is start at a minute and just keep adding a minute. I promise you that tiredness will win, and your baby will eventually go to sleep. Your next challenge will be at that first wake, 9 o'clock, 10 o'clock, whenever the first wake happens. What you're going to do is you're going to listen, and you're going to see, can your baby put himself to sleep? If he can, you haven't got a sleep problem. So if you're doing sleep training, the chances of him being able to put himself back to sleep are slim. So you're going to listen and hear, give him a chance to scoffle about and shout a bit and see if he can put himself back to sleep. If not, you go, you pick him up, you cuddle, you love him, you fill up his emotional tank. You make sure he's not thirsty and not sick and all of that. Back into bed. And talking about thirst, in the night you can always offer water from about 6 weeks onwards to quench thirst. But just remember, water is never, ever given in place of a milk feed. And it must always be pre-boiled. Okay, preferably breast milk. So, you're going to go back, you're going to re-calm your baby, but you're not going to hold your baby or feed your baby to sleep. You're going to do that till calm. Back into the bed, night-night, leave again, back to 1 minute of separation. Work with your baby. In, out, in, out, in, out. So the first night, there might be a lot of toing and froing. Your older children usually vomit. So, because they're clever enough, especially the ones who can stand, sort of from about 9 months, they pull themselves up, ding, 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 rattle away on the side of their cot, and they shout a lot. And especially if they've just had milk, if it's a bedtime feed, they often make themselves vomit. Just remember, if your baby has got gastro and is vomiting because he is sick, you will not be doing sleep training. So your baby's not sick, he's vomiting because of all the snot and trana. Okay, don't be scared of him. You need to shift those expectations around sleep. You will be really pleasantly surprised how quick and easy this will be, as long as you stick to the program. Okay, if you change the thing and feel sorry for your baby at 2 in the morning and give in and give him a feed when you know he doesn't need a feed, all you're doing is you're teaching him he has to just shout and perform and carry on in order to get what he wants, but he doesn't necessarily need. Remember that. So as Magic Johnson says, all kids need is a little help, a little hope, and someone who believes in them. You can do this. So the next thing is dummy patrol. So you don't necessarily have a bad sleeper or a child with a bad sleeping disorder, but you're up and you're doing dummy patrol the whole night long. I remember those days, and I'd wake up in the morning and I'd say to Ken, how many times did we get up last night? And you kind of just on automatic pilot. It usually happens around about the 7-8 month age group. And you kind of just walk on air to the cot and plug up your baby and go back to bed, and in the hope, after the moon, before the moon, when the rains come, when the rains go, when the tooth's out. By the way, teething causes teeth. Teething does not cause a sleeping disorder. Okay. If your child is teething enough to cause a bad sleeping problem, he will be miserable 24/7. They don't only have teething pain at night. So if your baby is battling with teething, he will be miz in the day as well. He'll be off his food, he'll be hot and bothered. They often have a bit of squishy poos and their noses stream a bit and they get a bit of a rash. There are plenty of other signs. And if your baby is teething and showing those signs, that's what medicine is for. So that's when you bring out your paracetamol or whatever it is that you've worked out that works well for your baby. So please do not blame teething on bad sleeping. So, dummy patrol, to get back to that. So what you need to do, you know that your baby will be able to grab things and put things back in his mouth between 6 and 8 months of age. He will learn that skill. Give him a chance to. So instead of just always rushing back to plug in the dummy, because then you know, thank God, shush, and maybe tonight it'll only be once, but it won't only be once. Okay. Put the dummy in your baby's hand, and your baby will automatically put his hand to his mouth with the dummy in it. So give him a chance to. When you put him to bed at night, put one here and one there and one here and there and there and there, because if you only put your baby to bed with one dummy, he's going to turn over and it's going to get caught under his arm or whatever, and he's going to wake up and he's going to panic. Where's my dummy? That's there again, that's important to have a little night light to make sure that when he wakes up, he can see his dummy. If it's in the pitch dark, he's not going to see it. Okay, and the glow-in-the-dark ones don't work if they haven't had enough light at the outset to, like, charge them. Okay, so you're going to wait and give him a chance to see, can he find his own dummy? If not, you're going to go in after a couple of minutes and you're going to put it in his hand so he can put it in. So that's a bit of time and effort, and it'll take you a couple of days and he'll get it right. Give him a chance to. Our babies are far cleverer than we actually give them any credit for. Okay, so wait before responding. That's the big thing. There's a wonderful book called Why French Children Don't Throw Food. Has anybody read it? Okay, very interesting title. It's written by a British child psychologist who went to live in Paris, and with a revolting 15-month-old who was just all over the place. And they couldn't work out right when they went out to eat. There were all these French children at the same age as their child, sitting very happily at the restaurant table and waiting for the French, to have their 6 courses and whatever. And she started researching, well, how do the French parent differently? They're cultural. And what they call pause. So they practice pausing before responding. Very interesting book, Why French Children Don't Throw Food. Yeah. So, pause. Just remember the pause. You don't have to hyper-respond to your baby all the time, unless they're about to fall out the cot or pull a pan of boiling water. Give your baby some chance to see if they can sort themselves out. Right, so, a lot of information that we've roared through in these last 45 minutes. Just remember, as Mark Twain says, you can't break a bad habit by throwing it out the window. Sleep training is not easy. You have to walk it slowly down the stairs. It's going to involve you to give some time and effort to really just apply everything that we've talked about. Look at your notes, apply it to your individual baby. And remember, if you don't start at the beginning, you're never going to end at the end.
Mothering is our highest calling and hardest work. For the high and lows, Baby Sense is with you on your journey. Thank you for nurturing and touching the future. We would like to thank all our sponsors. Without their support, it would not have been possible.